Welcome to the Med Madness podcast, where we break down complex medical topics to help you excel in your studies and career. Today, we're diving into the crucial topic of decision-making capacity in medical ethics. Understanding this concept is vital for all medical professionals as it directly impacts patient care and autonomy. Throughout this episode, we'll explore the key components of decision-making capacity, discuss various scenarios where it plays a critical role, and learn how to assess and respect patient decisions effectively. In this episode, we'll cover the essential components of decision-making capacity, how to assess decision-making capacity, special considerations in different clinical scenarios, and a real-life case study to illustrate these principles in action. Next, let's discuss the components of decision-making capacity. Decision-making capacity, or DMC, has four primary components. First, communicates a choice. The patient must clearly indicate their preferred treatment option. Second, understands information provided. The patient must comprehend their condition and the available treatment options. Third, appreciates consequences. The patient should acknowledge their condition and understand the likely consequences of each treatment option, including no treatment. Finally, rationale given for decision. The patient must be able to weigh the risks and benefits and provide reasons for their decision. Next, let's move on to assessing decision-making capacity. Assessing DMC involves evaluating these components, especially if there are changes in the patient's mental status. It's important to consider factors that could affect cognition, such as delirium, infections, metabolic derangements, or the cognitive effects of medications. If a patient regains capacity, their decision should be respected over any surrogate decision maker or previously documented instructions. Next, let's look at special considerations in different clinical scenarios. First, post-operative patient refusing further treatment. If a patient who was previously incapacitated now refuses further procedures, reassess their decision-making capacity considering any factors affecting cognition. Next, a pregnant patient with Category 3 fetal heart rate tracing. A pregnant patient refusing an emergency caesarean delivery must have her decision respected if she has the capacity, even if it impacts the fetus. Next, an acutely psychotic patient requesting non-urgent surgery. Treat the underlying psychosis to restore decision-making capacity before proceeding with non-urgent surgery. Next, a patient with mild intellectual disability refusing urgent surgery. Utilize additional measures such as family assistance, simple language, and visual aids to facilitate understanding and assess capacity. Next, an elderly patient refusing cancer treatment. Clarify and explore the patient's rationale for refusing treatment to ensure it is an informed decision. Finally, a patient with psychotic illness refusing life-saving treatment. Assess if the psychotic symptoms interfere with decision-making capacity and respect the patient's decision if they can understand and communicate their choices. Now, let's consider a real-life scenario. A 68-year-old woman with mild intellectual disability presents with acute cholecystitis and requires an urgent cholecystectomy. She initially refuses surgery. Instead of assuming she lacks capacity, her physician takes extra measures to ensure she understands her condition and treatment options. He explains the situation using simple language and visual aids and involves her family to help clarify the information. After these efforts, she demonstrates understanding and consents to the surgery. This case highlights the importance of not prematurely judging a patient's capacity and taking steps to facilitate their understanding. In conclusion, we discussed the key components of decision-making capacity and how to assess it, considering various clinical scenarios. Remember, respecting patient autonomy is fundamental in medical practice. To reinforce your understanding, don't forget to engage with the pre- and post-podcast quizzes and Anki flashcards we've prepared for you. These tools will help solidify your knowledge and prepare you for real-life clinical situations. Thank you for tuning in to Med Madness. Stay curious, stay informed, and keep making a difference in the world of medicine.